Imagine living in healthy relationships, with greater acceptance among you, without fights over forgetfulness, poor communication, or lack of organization. You can learn all of this in the club. ADHD in Action, the toolbox for ADHD. Check it out in the first link in the description. What should you, as a parent, ask the doctor when taking your child for an ADHD diagnosis? Maybe you haven't seen any videos about this in more detail, right? Sometimes the videos just say, oh, do this, take it, then the professional. But all right, how do I get there? How will I know if the professional who is treating my child, be it a doctor or a psychologist, is really someone who is qualified and will provide guidance? All right. Anyway, this video will answer those questions for you. Taking them to the doctor or psychologist is the first step. This is the first step for you to start off on the right foot for the future. ADHD treatment? Don't treat ADHD. Not every sign is ADHD. Remembering that there are several other pathologies and disorders that are confused with ADHD. So, not everything that shows a little sign or two of ADHD is actually ADHD happening there. Before thinking about treatment, you must think about the issue of diagnosis, a well-made diagnosis, beauty. This should be a conscious decision. When parents realize their child is struggling and things are bad, stop ignoring it, that things aren't going well, and that you stop sweeping this situation under the rug thinking that it's just how it is, that it's just a phase. No, my friend, it's not just a phase. When you have underlying difficulties and the school informs you that your child stands out from the class due to unique behaviors and reactions, unlike the rest of the students, and the rest of the class isn't doing that, the rest of the class, the average of the students, is managing to respond much better to the lessons, to the school activities, and your child isn't. So don't ignore that. This is an important sign that yes, something is wrong. So don't ignore that. This is an important sign that yes, something is wrong, that's not right, and then you should take them to the professionals to find out what's going on. One very important point is to prepare yourself for the first appointment. And this is important so you can prepare in advance. It's very interesting for you parents to make a list of what worries you the most about your child. Don't be afraid to think that you might be overreacting. Or thinking too much, usually when there's a little nagging feeling about socialization, about keeping up with the class, the rest of the class, in other words, everything you're seeing that isn't right. It's not your exaggeration. Your intuition really needs to be taken into account. You really have to take this seriously. Write it down and take it to your doctor, to the therapist who will start the diagnostic process. I'll add something here saying the following. I usually say that the best professional you should see first is a neurologist. Okay, because he will already be able to help rule out some comorbidities or not. It's interesting that he is the first professional there, but it's also essential that he goes at least to the psychologist, okay, or to the neuropsychologist, who will also apply several tests and observe some nuances as well. Other professionals, they are also important. I've already made a video about this, about the diagnostic guide. What's important? It's important to know whether you should go first or not, right? Which is the first professional you should see and should appear in this card here. What is this video I already made? But don't watch it right now. Stay with me here in this video because there's more important stuff I need to tell you. Make a list of the environments, how it is at home, at school, with neighbors, with relatives. For each of these topics, you list the behaviors, the situations, the nuances that worry you. Even if you're not sure whether what you're noting down is abnormal or normal, if you have a suspicion, write it down. The professionals will clarify those suspicions. In a second list, also mention your perceptions about the child's maturity, intelligence, and any sensory issues you notice, like hearing, vision, touch. Also, list if you see episodes of aggression or aggressiveness, if there are clear signs of lack of attention, that is a certain attention deficit in something, etc. And if possible, if you think there's already that openness, go to your child's school and collect that report from the teacher and the coordination. Don't expect the professionals, for example, the doctor, the psychologist you're going to contact, ask for that report from your child's school, especially since not everyone requests this. I'll talk about that in a little bit, okay? But every treatment, every diagnosis, the professional does it his own way. This guide offers the best actions to gather information. Reflect thoroughly to make your time with the doctor and psychologist productive. Reflect as much as possible so that it is as much as possible. That moment during the diagnosis when you're in front of the doctor and the psychologist can be very beneficial. In other words, also request that report of perceptions from the school regarding your child. And even if you sometimes disagree with that report, believe me, the school is not picking on your child. They don't hate your child, okay? Sometimes it's hard to hear criticism about your child, but take it. in stride, bring it to the specialist. Now ask yourself this question. Everything else you're going to take and work on there. Got it. So now the question you must be asking yourself, right? After all, how is the diagnosis made? How is the ADHD diagnosis done? What is the process like when you enter the office and leave with a report? Well, there are usually several stages of interviews. Let's first talk about the interviews with the parents. In other words, the father will be interviewed by the doctor and the parents will also be interviewed by the psychologist. At this moment, it's important that both are present. If you have a child, it's important to make peace temporarily. Ex-husband, ex-wife, whatever it may be, it's important that you make peace temporarily because this diagnostic period is very important. So parents need to put aside any disagreements they have, or if you're married, even better, don't face that. And it's very important that both are present in the office. The doctor is going to ask you several questions. Among them, it's also interesting to ask if you had any significant events, for example, during pregnancy or any genetic event. For example, the professional will also ask if you notice the presence of those symptoms and behaviors in other family members. In addition, during this interview, he will conduct the famous anamnesis, which is a questionnaire of retrospective questions regarding the child's past. From birth up until now, questions that are noticed during the first few months of life, during the phase when you start to crawl, walk, and say the first words, whether there was any delay in speech or not. So this history is interesting. Pulling from the parents, this history of the child's progress and also their behavior, it may also be necessary for him to conduct some type of medical evaluation on the child, even to assess physical abilities. For example, I have an important comorbidity, which is dysgraphia. My handwriting is terrible. It's really terrible. No matter how hard I try, I can't write in cursive correctly. My handwriting is very smudged, very messy, and I know that this has a physical origin, which unfortunately I only discovered now 1, 2, 3 years ago through a consultation I had with a friend of mine who is an occupational therapist. I discovered that my imbalance in cursive writing in the movement of my hand comes from a malformation. It's not even a malformation. It's that the bone here from the shoulder blade, I think shoulder blade isn't the right name for it. This bone here at the back is smaller than it should be. It is smaller than the structure I have. So this causes a lot of imbalance. I should have done, for example, some specific exercises since I was little to strengthen that area of my shoulder from the back, from the chest, and as a result of that, I would have a correction or an improvement in the issue of dysgraphia. Since I've never done that, my handwriting is still bad today, and that's totally fine. So this type of test can be requested by the doctor. It can be requested by the occupational therapist who can also be involved in this evaluation. Okay? But I'm not to stray far now. Let's talk about the doctor. I'm talking about the doctor. Okay. There's this interview, there's the issue of medical history. Next, there can also be this medical evaluation, which is interesting, that he asks for your child. And all of this adds up 5%, 10%, 15%. In other words, it increases the chance of you reaching 100%, which would be a more accurate and correct diagnosis. Apply DSM-5 questionnaire for child behavior classification. Classification of the child's behaviors, which is a test based on the DSM-5 questionnaire. DSM, which is the Diagnostic and Statistical Manual of Mental Disorders, is a book used by doctors. It's a book this thin, which is already in its 5th edition, and it provides some guidelines for professionals to reach a clinical diagnosis. So it's also interesting for parents to fill out this questionnaire, and depending on the score, it will provide guidance for the correct diagnosis. It may or may not be ADHD. At this moment, the doctor can also ask the school, the teachers, to fill out this type of questionnaire, providing an evaluation of the child. If it's not possible given the situation you're in, that report you requested from the school, from the teachers, can also serve as a guide. Understand that what I'm saying here is that I'm providing guidance on what could be a procedure there after you reach the professional who can give a more accurate and precise diagnosis, but not always. This is the law, okay? I'm not saying that sometimes you won't follow any of these steps and that you won't get the correct diagnosis. However, the more you follow what I'm suggesting, the greater the chances that the diagnosis will be really accurate. In addition, moving on a bit to the professional, which is the psychologist, who should also be involved. Okay, it's not ideal for the diagnosis to be made right away only by the doctor, the pediatric neurologist, or the child psychiatrist. It's interesting that it goes, as I mentioned at the beginning of the video, also by the psychologist, because the psychologist will apply other tests on the child, like aptitude tests, memory tests, IQ tests, which will also help finalize this diagnosis. In addition to taking the medical history with the parents and perhaps repeating some of those processes you've already started with the doctor. Now, what are these professionals also going to have to do? Interviewing the child, especially depending on their age, starting from 6 years old, is more interesting. For making the diagnosis, although it doesn't prevent a younger child from being correctly diagnosed as well. Everyone says it's better to start from 6 years old because it increases the chances of you getting a more accurate diagnosis. Usually this interview can take place without the parents present. And then he's going to ask things like, what does the child like to do? Which cartoon she likes, the game she enjoys. Of course, the idea isn't exactly to find out what she likes or not, but to understand and notice the nuances of how she tells it. That how she dives into a certain topic can be really interesting for her, or not. And this interview doesn't have a determining role in the medical report to know if the child has ADHD or not, because everyone knows, and you should also imagine, that the child can behave completely differently in the office. So to give you an idea, as I've said many times here, there are many professionals who, despite being trained in medicine or psychology, have a full understanding. Let's say some mothers have heard from doctors that the child didn't have ADHD because she was quiet in the office. And it even became unrecognizable to her own mother because after leaving there, the child went back to showing the typical behaviors of a very hyperactive child with ADHD. This happens because in the face of something new, whether it's a new place or a new person who's present, who is the doctor, who is a stranger to everyone, that can become something unusual, interesting, and stimulating that makes the child very attentive to what's happening there. So some children will start to get off the chair and walk around the office and start to... If there are things in the doctor's office, for example, some books, they might start wanting to climb the shelf, and that also becomes part of the evaluation. The doctor will keep an eye on the child. There can also be children who, whether in the presence of their parents or not, will behave in a completely atypical way, that is being very quiet, even though in reality she has a more, let's say, hyperactive behavior. I don't really like that term, but it's a more restless behavior. Let's put it this way, the doctor has to know that the fact that the child is temporarily well behaved in the present moment, it's also a characteristic of ADHD that in some situations different from the usual, right? Different from the usual pattern to elevate your levels of neurotransmitters, of mental stimulation. And so she can perform and perceive herself much more in that situation. In addition to questions about hobbies, what the child likes or doesn't like to do, they will also ask about school and what the child thinks about that school. How are people treating her? If the child realizes that there's some kind of problem with her, if she feels a bit different, if she thinks the other kids treat her differently, or if the teacher treats her differently as well, all of this will be part of the interview with the child. Questions like what the child would like to change at school, what could be better, what could improve. Let's put it this way. And also, lastly, the doctor might ask her directly or indirectly depending on her age. If she realizes that she has some of those typical symptoms of children with ADHD, well, as we already know, the diagnosis for ADHD is predominantly clinical. There's no need for you to do any other type of test, like, for example, a blood test or imaging test to diagnose ADHD or not. However, if in this whole situation the doctor or even the psychologist advises you to do a test like an electroencephalogram, is there something along those lines? Go ahead, it's all good. There might be some diagnostic hypothesis, some comorbidity that they are suspecting, and that this exam can help assess how the brain's electrical functioning, the mind of that child, if necessary, also during the diagnostic stage. If the doctor and the psychologist think it's appropriate, they can definitely refer you to other professionals like occupational therapists, speech therapists, or educational psychologists at least once with these professionals to confirm or rule out any suspicion of a possible comorbidity, like, for example, dyslexia, dysgraphia, or a developmental coordination disorder, which is central auditory processing disorder. In other words, don't be rigid. Understand that what I'm giving you here are good practices so that you can achieve a good assessment for a good result regarding the diagnosis. But this isn't an absolute rule. Okay, adding or reducing steps can also lead to a good result. But this is here to guide you, to know if what they're doing is far from this, here or not. Okay, and if you are a parent of a child with ADHD, don't forget to get my book. Everything parents need to know to help their children is available for sale on Amazon. It's being very well received and can definitely help you with essential tips. So in guiding your child, cool. So that's it. I'll see you in the next video. Thanks. Bye. Many times you find yourself pretending to be someone you're not just to avoid feeling out of place in conversations. Isn't that right? This can be the impact of ADHD, referred to as the inauthentic self. Learn to identify and change this game with the method I created and use every day. Check it out in the first link in the description.